Welcome. Today we're discussing testicular cancer, a disease that affects the male reproductive system. Understanding this condition is crucial for early detection and effective treatment. We'll cover everything from its causes to potential advancements in research. The exact cause of testicular cancer remains largely unknown, but several risk factors have been identified. These include undescended testicles, also known as cryptorchidism, a personal or family history of testicular cancer, being of Caucasian ethnicity, and certain genetic conditions like Klinefelter syndrome. It's important to remember that having these risk factors doesn't guarantee you'll develop testicular cancer, but it does increase your susceptibility. Testicular cancer typically begins in the germ cells, which are responsible for producing sperm. These cells undergo uncontrolled growth and proliferation, forming a mass or tumor within the testicle. As the tumor grows, it can invade surrounding tissues and potentially spread to other parts of the body through the lymphatic system or bloodstream. The specific way it spreads depends on the type and stage of the cancer. Testicular cancer is relatively rare, accounting for only about 1% of all cancers in men. However, it is the most common cancer in men between the ages of 15 and 35. The incidence rates vary across different populations, with higher rates observed in Caucasian men compared to African American and Asian men. Early detection and prompt treatment are key to a positive outcome due to the high curability rate. The most common symptom of testicular cancer is a painless lump or swelling in one of the testicles. Other symptoms may include a feeling of heaviness in the scrotum, a dull ache in the abdomen or groin, back pain, enlargement or tenderness of the breasts, and fluid collection in the scrotum. It's crucial to note that not all lumps are cancerous, but any new or unusual changes in the testicles should be promptly evaluated by a healthcare professional. Diagnosis typically begins with a physical exam by a doctor, where they will examine the testicles for any abnormalities. If suspicion arises, further tests will be ordered, including scrotal ultrasound to visualize the testicles and identify any masses. Blood tests may also be performed to measure tumor markers, such as alpha-fetoprotein, human chorionic gonadotropin, and lactate dehydrogenase. A biopsy is not usually done due to the risk of spreading cancer cells. Instead, the testicle is removed for further examination. Testicular cancer is broadly classified into two main types: seminomas and non-seminomas. Seminomas tend to grow and spread more slowly and are more common in older men. Non-seminomas include several subtypes such as embryonal carcinoma, yolk sac tumor choriocarcinoma, and teratoma. These types often grow more rapidly and are more likely to spread. The specific type of testicular cancer influences treatment options and prognosis. Treatment for testicular cancer typically involves surgical removal of the affected testicle, called an orchiectomy. Depending on the stage and type of cancer, radiation therapy, chemotherapy, or a combination of both may be recommended. Treatment plans are individualized based on the patient's specific situation, and the multidisciplinary approach involving surgeons, oncologists, and other healthcare professionals is commonly used. Surveillance is also a treatment strategy where the patient is monitored closely over time for any signs of recurrence. Currently, there's no definitive way to prevent testicular cancer. However, regular self-exams of the testicles can help with early detection. Men with risk factors, such as undescended testicles, should discuss preventive strategies and regular screenings with their healthcare providers. Early detection remains the best defense against this disease. The prognosis for testicular cancer is generally very good, especially when detected and treated early. Many men with testicular cancer are cured and go on to live long and healthy lives. Ongoing research is focused on developing new and less toxic treatments, identifying genetic markers for risk assessment, and improving our understanding of the disease at a molecular level. These advances aim to further improve outcomes and quality of life for men affected by testicular cancer.